How do blood test markers help predict bone cancer? Imagine trying to catch a sneaky problem early before it causes more damage. Blood test markers are like clues that can hint at trouble brewing in your bones. They help doctors get a better idea if there might be bone cancer or if something else is affecting your bones. These markers are specific proteins and enzymes that the body produces when bones are active or when cells are damaged. One of the main markers doctors look at is called alkaline phosphatase, or ALP. This enzyme is involved in breaking down and building up bone tissue. When bones are growing, healing, or being affected by cancer, ALP levels in the blood can go up. A related marker is bone-specific alkaline phosphatase, which is more directly linked to bone activity. When these levels are high, it can suggest that abnormal bone processes are happening, possibly due to cancer cells invading the bone or causing increased bone turnover. Another enzyme sometimes checked is lactate dehydrogenase, or LDH. Elevated LDH can indicate increased cell activity and tissue damage, which might happen in bone cancer. But it is important to remember that these markers are not exclusive to cancer. They can also be elevated in other conditions like fractures, healing bones, or even in children who are still growing. Scientists are also exploring other proteins and circulating tumor cells that could help detect bone metastases early or monitor how the disease is progressing. However, these are still mostly in research stages and are not yet standard tools for diagnosing primary bone cancer. Blood test markers are most useful when combined with other diagnostic tools like X-rays, MRI scans, CT scans, or biopsies. They can help doctors track how the disease is changing, see if treatments are working, or raise suspicion when symptoms or imaging results are unclear. In summary, blood test markers like alkaline phosphatase and bone-specific alkaline phosphatase can point to abnormal bone activity that might be caused by bone cancer. But they are not enough on their own to make a diagnosis. These markers are valuable for supporting diagnosis and monitoring, but always need to be interpreted alongside other tests and clinical evaluations. If you have concerns about bone health or cancer risk, it's essential to consult with a healthcare professional who can provide personalized advice based on your individual situation.